Hey everyone, knee injuries are a super common running related injury and often we end up having to stop our running, but do we actually need to? Maybe not. There are a lot of strategies that we can start to put into place to allow us to continue some sort of training or maybe even running. Now, if we think about what the knee and the quad does when we're running, it's predominantly acting as a braking force, and that's particularly noticeable when we're running downhills. So if you've had knee pain before, you probably noticed that running downhills is the absolute worst. So we want to take that all into consideration when we're sort of devising your return to running program if you have had a little bit of time off. And as I said, more often than not, we can keep you running. Now, it sounds a little bit backwards in a way, but that often means an uphill running program. So the way that we tend to do it is we'll start you with some uphill walking if that's where you're at. However, if you can tolerate it, then we might actually be able to jump you to uphill running, so just to keep that capacity there. Now, the easiest way that we do this is on a treadmill, however we can do it outside if needed. Typically we'll set you up on an incline of 3 to 5% and we'll choose the intervals based off where you're at with your injury. Now, the next progression from there is progressing you to level running. So we'll bring it back down to the flat again on the treadmill if we can, but outdoor is possible as well. And again, to reduce the knee loads, we might have a look at increasing your cadence by about 5 to 10%, can have a reduction of about 19 to 33% on peak knee loads, which is really important when we're trying to reduce the overall load around the knee. And then from there, depending on how your symptoms are going and how quickly they're progressing, the last step is to get you back to your normal training. So hills and speed are going to be the harder things for us to reintroduce, so we'll do them at a graded approach. But this is how we tend to progress someone through their rehab while keeping you running with whatever knee injury you might have after a thorough assessment. There's lots of work that we can do in the gym from a strength perspective, but for today, I just wanted to have a chat about how we can keep you running.